So I'd like to open this up to see if anybody has any questions or before we leave.
Would you like to address the supplements and vitamins, that what we should and should not, if there's any herbs and things that we shouldn't be, as a normal procedure, taking?
What about the herbs and vitamins that you take? Should you stop those before surgery? Should you take them afterwards? That is something that actually could potentially interact with some of the medications we give you. So certain herbs are listed on the sheet that the physician's offices send out to you. Simple things, even like garlic, a garlic supplement that some people take could actually increase your bleeding. So those are very, very good things to review.
All right, we have a question on home care after we get home after surgery. And if, the normal pain pills are not working, do we call the hospital, call the physician, or just call Kimber in the middle of the night? And then what about ice, and what hints can we use for using ice on either the knee or the hip joint, and how does that work?
That's excellent. For the first part of the question with the pain medication, if your pain medication isn't working for you and you're at home, you need to call the doctor. If you called me, that's what I would do. I would call the doctor for you. But it's just easier for you to go to the horse's mouth and call that doctor and see if they can prescribe something different for you. Now, there are some different things that you can do besides taking pain pills, and that's elevation and ice. And you brought up the ice. That's very important. And most everybody is given some ice packs of some form here in the hospital.
How important is it to keep the pain under control?
It's incredibly important to keep your pain under control so you get the full benefit of any exercises and stretching that you're doing. What we do in the hospital is all of our nurses are specially trained in total joints and taking care of people that have had this type of surgery, and they all pretty much give you the pain medication around the clock. They'll ask before you actually take it how bad your pain is and everything. But one of the key things that we do is about a half an hour to an hour before each physical therapy session to make sure you have some pain medication on board. And that'll keep you relaxed, and you'll get the full benefit of those exercises that we're doing. A lot of people may have some concerns of becoming addicted to pain medication, and that can certainly happen with some of our very powerful medications that we give. But if you're taking that medication for pain and not something else, it's not an addiction. You need it. And then you'll get the full benefit of your exercise and a better recovery in the long run.
I tend to be a couch potato. How much of this physical therapy should I really do?
When we have people that have to undergo a surgery like this, typically you've got, this vicious cycle going on where you can't exercise because it hurts so bad. And people get into that very depressing, very couch potato type mode. But once you have the surgery, if you want to improve the quality of life, you need to do the exercises. There's no sense in going through all of this if you're not going to use it. The whole point to this is to improve your quality of life. So the old saying goes, if you don't use it, you lose it. And then you're right back where you started, and perhaps worse. Some people that don't do their exercises, they have things happen with scar tissue buildup, and they can never regain the full function of that total joint again. They'll have to have a repeat surgery or a manipulative procedure to get that joint moving again. So it's very important not to be a couch potato and to get up and move.
If you do use a CPAP at night for the sleep apnea, is that something that you should bring to the hospital so that it's available to obviously plug in at night and the nurses would do that for you or give you some help with that?
So yes, I do want you to bring in your own CPAP. We bring it in and we have engineering do a check on it to make sure it's safe for use here in the hospital. And then we'll put it in your room and you'll have that ready to go. And our nurses are pretty used to using the CPAP, so they'll be able to hook you up if you need assistance doing that. Now, if you forget and don't bring it in, we do have equipment here at this facility that we can use. It's just not quite as comfortable as your home CPAP might be.
I'm coming from out of town, so I was wondering what type of places my family might stay.
We can help you make some arrangements. We do have a hospitality house associated with Mercy Medical Center. It's just right on the corner next to the hospital. It's fairly small and gets filled up pretty rapidly depending on what's going on. But we could possibly get a hold of the hospitality house room, or we could also offer some discount rates at certain motels here locally too. And I have a list of that in my office, and I can get that to you so that you have a little bit less expensive accommodations. I want to thank you all for choosing Mercy Medical Center and attending this class. If you do have any more questions at all, please give me a call at area code 530-225-7759. It's in the first page on your guidebook, or you could email me at kimber.graves@chw.edu. Thank you.